Bring in co-chair of the House Doctors Caucus and Republican representative for the great state of North Carolina, Greg Murphy. It's good to see you, sir. Congressman, is the reporting that we're saying accurate on the president's proposal, and what are your thoughts on it?
Yeah, I mean, I believe the reporting is accurate. This is, this has been a plan that a lot of folks have been talking about. Remember, Chris, Obamacare was written by insurance companies for insurance companies, and it exploded. And that's why the Democrats had to, quote, have their temporary COVID relief to further expand the policies. Now they're due to expire. And this is problematic for a lot of people in the country, Because look, also, if you'll look at stock prices for insurance companies, these have been plummeting. So they have to have a way to bolster their stock, bolster their profits. So they're raising premiums. There are other things to go on with premiums. But this is a good part of what's happening. I'm glad the president's working towards this. We're going to have to do something. But in the meanwhile, also really, really need to work concurrently on how we lower healthcare costs in the country.
As you know, Obamacare on purpose destroyed catastrophic loss policies. Those who are interested in the doctor-patient relationship tell me we need to restore the catastrophic loss policy market for inexpensive protection against the proverbial cancer diagnosis or getting hit by a bus or something like that. Then allow our people to write off all of our health care expenses and save through health care savings accounts tax-free, and let the real cost of health care reset. By example, I just had to pay a visit to the ER here recently. And because I kept insurance companies out of it, my bill was cut in half. What's wrong with a plan that doesn't allow government to weaponize our health care the way Democrats just did with food stamps during their shutdown?
Sure, I don't have any issue with that whatsoever. The other thing is, again, as I said, the insurance companies didn't want competition, so they made something called associated insurance illegal, where plumbers, craftsmen, or whatever would get together on a large scale, form their own insurance company. These have been done, some were grandfathered in, and their premiums went up a minuscule amount. This is driven by insurance company profit. And you've seen, I see now ads upon ads. When you scroll and look at anything, they're defending themselves, saying how great they are and what their care they deliver. Now, this is about insurance company profits. And what's happened is now, what we've seen now is the third arm of the Democratic Party. Used to be just the second arm was media. The third arm now is insurance companies. They paid millions and millions of dollars to get Prop 50 across the line in California so that they could redistrict out a lot of Republicans. So, look, the Democrats want more insurance company profits. They want this to push towards a single-payer system. And, it would blow up in our face, honestly, if we did not do something in the short term to push these subsidies. But then we really, really, really have to get down to business as why healthcare costs so much, because I think it can be done to whittle down things so the average American not go bankrupt just trying to afford healthcare.
Yeah, I don't call them the traitorous insurance companies for nothing. Before my vacation, I had talked to several professionals in the insurance industry and in the medical field and heard from, just regular folks. Taxpayers funneling trillions of dollars into insurance companies only led to higher premiums and lousy insurance, and Americans have never been paying more out of pocket. I have said if we want to save health care, we need to kick government and insurance companies out of it. Am I wrong?
Yeah, I don't know how we do all that completely, because you have to have Medicaid, we have Medicare, this is in statute, those are not going to go away. But the middle folks, the 170 million individuals who get insurance from their employer, it's only 7 or 9 million people who are on Obamacare. Look, Chris, I'm on Obamacare. I have to be as a member of Congress. My premiums, I got them the other day, have gone up 100% in 4 years. The cost of medicine has not gone up 100% in 4 years. So again, this is to protect insurance companies. And I think this message really needs to go back to the American people. Really, who is causing the rise of cost of health care? It's not just insurance companies, but they have a large part in their profit motive.
Well, if you want more of it, you subsidize it, right? I mean, the more the federal government backstops anything, the costs go up and up and up and up. And that's why I say getting government. I mean, we've seen it with college tuition, Congressman. You know what I'm talking about.
Absolutely.
That we need to have free market solutions, and that will relegate prices. It's called supply and demand, and it works everywhere, and it ought to be allowed to work in healthcare. Happy Thanksgiving to you, Congressman. Appreciate the conversation.
You too.
Thank you, sir.
Take care.
Coming up, Minnesota.